Again, good morning, everybody. My name is Leanne Foster, and I am a provider, pardon me, provider outreach and education specialist here at WPS Health Solutions. And I want to welcome you all to our session on roster biller coverage and enrollment basics today. On the line with me, as I said, is my friend and colleague, Ellen Barra, who will be monitoring the chat for any questions that you have. So with that, I am asking that you throw your questions into the chat. I encourage questions during this session. Certainly make this yours. We want to make sure that the session is beneficial to you and you have everything that you need. So certainly throw those in the chat. I also encourage that you throw those in the chat as you have them. Like I said, Ellen's going to be monitoring those, so we're not going to miss any of those. But I certainly don't want you to hang on to it and try and, I don't want anyone to forget their question before we get to the sessions where I check in with Ellen for questions. I do have a little bit of housekeeping to take care of before we get into the material for today. So first and foremost, the materials for today, which is the presentation that I'm currently sharing with you, that is available on our live events page. If you would like that to follow along with during this session and have not already downloaded that, you can go out to our live events page. And for your convenience, I am going to ask Ellen to throw a link into our chat so that you have that. Once you're out there, you'll look for today's event. You will see a training materials link. You'll click on that. That's going to bring up the PowerPoint and let you download that so that you have that. It's certainly not required for participation in today's event, but it's there and available to you if you want to. As I stated earlier, we are leveraging chat for questions, and Ellen is monitoring that. So please feel free to throw your questions as you have them into the chat. And then we're going to give you a couple of opportunities today to share feedback with us on how we did. My goal is to ensure that you get everything that you need out of this session today. We want to give you an excellent customer experience. And so we do have a CMS survey where you can tell us how we did. What did you like? What did we do well? What didn't you like? What could we update? But besides that, this is also your opportunity to provide feedback on educational topics that you'd like to see in the future. So again, you'll have a couple of opportunities. Links will be placed in the chat for you if you'd like to provide us with that feedback. I certainly encourage you to do that. We do use that to direct our further future education as well, so I thank you for that. Also, I have a disclaimer. Our session today, the materials presented today in our session is accurate as of today. So if you've worked with Medicare for any period of time, you know that Medicare changes often. So you want to make sure that you continue to leverage CMS communications, including the CMS website and the WPS GHA website, to ensure that you're complying with all the most up-to-date CMS rules and regulations. The basis for questions today, they're going to include not only current CMS regulations, but also the information that's provided in that chat. I also mentioned earlier that we are recording this session. Because of that, CMS does prohibit photographing, screenshotting, or recording this education for profit-making purposes. You'll not even need to do so for your reference. I am recording this and will be posting this as soon as possible after today's session, barring any technical issues with the recording. But that will be posted on our live events page as an encore presentation. And it will live out on our live events page as an encore for 90 days. It will also be placed on our YouTube channel, and it will remain on our YouTube channel indefinitely as long as the information is still current. The benefit to it being on our live events page is that you do not need to go to YouTube to view it, which we recognize not everybody's able to do at work. So it's there inside of a player, so you'll have that not only for yourself for reference if there's something you missed, wanted to see again, but also if you know somebody that would benefit from watching this video, we encourage you to share this information with them as well. That brings me to our agenda for today. Today, we're going to talk about roster billing and mass immunization providers. So during our session today, we're going to be covering a few things. We're going to talk about just a brief overview of roster billing and what that is, high level. We're also going to talk about coverage for mass immunization suppliers, and we're going to look at what the enrollment requirements and process look like for those mass immunization providers that are wanting to roster bill. That's going to include a walkthrough of the application that those mass immunization providers would need to submit in order to enroll. And it's going to include both the paper version and the electronic version of that application so that you can see what the differences are and where they are similar. Medicare is not without their acronyms, so to help you along today, I have provided a slide that is just including the acronyms that I'm going to use throughout the session today. Use this as reference so that you have that. So first I'm going to talk about what roster billing is. Roster billing was developed by Medicare to provide greater access for certain vaccinations, and it is a simplified billing method that's available to licensed individuals and entities that are conducting mass immunization programs. So we've all seen that it's that time of year where there's a flu clinic and there may be 50 people, there may be hundreds of people all going in and getting their flu shot, their COVID shot, their pneumonia shot. That is what a mass immunization program is considered. Now, I mentioned that it is for licensed individuals and entities. So this is something that can be performed by a physician's office. They're going to be enrolled. They'd be able to leverage this. It's also, and we'll talk about this a little bit more, for providers who might not otherwise be able to enroll in Medicare. And we'll talk about that in a few minutes. So a mass immunizer, just to come back to that, is defined as an entity that provides qualifying vaccines. As I said, it's the influenza vaccine, COVID-19, and the pneumonia vaccines to a group of beneficiaries. It is allowing providers to submit one claim for multiple beneficiaries. Typically, it's more than 5. It's not going to be, usually 1 or 2. It's usually when it's 5 or more, they're receiving the same vaccine. So what I mean by that, if a provider has held a vaccine clinic, say for 100 Medicare beneficiaries, and they all received the flu vaccine, they are going to be able to bill for all 100 of those flu vaccines on one claim. That's where the roster comes in, and we will talk about that roster. If the provider or if the vaccination clinic included or provided other qualifying vaccines, so let's say that they provided the flu, but they also provided COVID-19 vaccine, they could bill for those using a roster. However, it's going to need to be a separate claim because it is a separate service. The point is that on a roster, every beneficiary on that roster received the same service. So in the same example, there's a clinic, there's 100 Medicare beneficiaries. For simplicity, we're just going to say they all got the seasonal flu vaccine and the COVID-19 vaccine. It's technically 2 claims for all 100 of those beneficiaries. There'll be 1 claim with a roster for the seasonal flu and 1 claim with a roster for the COVID-19. But again, that's still easier than doing 100 claims. And again, it's meant to be that simplified process. Now, if during that clinic the provider also provided other services outside of those services that qualify for roster billing, they would need to bill separately for those. So if they did any kind of checkups or they were doing cholesterol screenings, blood sugar screenings, those are separate and those are not eligible for roster billing. So those would all still be separate claims by beneficiary. Again, same type of service, same date of service can be billed on that roster for those qualifying vaccines. And for questions on that, one thing, I did provide a link to both of these. I do want to show you some information that's available on our WPS-GHA website and also on the CMS website. So I am on our WPS website. I search. It's the easiest way to find things for me. So if I search by roster biller, it's going to pull up roster billing. And this is going to go through the criteria for submitting those claims, things we just discussed. It's also going to go in claims requirements for how to fill out that claim and submit that roster. And you'll notice right now I'm on Part B. That same information is available for Part A. So this is for both Part A and Part B suppliers and providers. On the CMS website, again, I search. And bear with me, it's just a little slow for a second. Under roster billing, you're going to see similar information. It's going to talk about mass immunization. It's going to talk about institutional and professional claims. One of the pre-submitted questions that we had was asking about billing for skilled nursing facility. And here what you're going to see is the valid type of bills, and skilled nursing facility is on that. You'd still bill it on that UB, but it will be with a different type of bill. And I've included links to both of those for you in your resources section today so that you have that. So as I stated, this is for qualifying services, qualifying vaccines. So to be eligible for roster billing, it is going to include the flu, the pneumonia, and the COVID-19. One of the things that we do see is hepatitis B. That is not a vaccine that is eligible for roster billing. Things like tetanus, those are not eligible for that roster bill. It is these three. Now, when you bill, that does include the vaccine and the administration. That code is includes both of those, and there is not a copay or a deductible for those services when you bill those. So let's move on to the roster. What does the roster have to look like? So here what you're seeing is an example. We do have this on our website, and I'm going to go out to ours. CMS does not have a standard roster, but MACs do create a roster. And if I search by roster, and I'm going to throw this link in the chat. I did not include that in your resources. Give me one moment to do that. But this is our roster, and I'm just going to switch back to Part A and Part B. It doesn't change a lot, but this is that roster. You can use this. Otherwise, there are things that need to be included, but this is already there. It's formatted. It's ready for you. It is a template that you can fill in. So the roster has to include the provider information. So it has to have the provider's name, their billing address. It's got to have their billing number, also known as their PTAN, that provider transaction access number, and then the date of service. And remember, everybody on this roster has to have received the same service on the same date of service. If you have multiple day clinic, that's going to be 2 rosters because it's 2 different dates of service. So it does also have to have the contractor number. That is one of the reasons that we've created our copy. It's going to have that information on it. You're not seeing it here, but it will. It needs to have the patient or the patient information. So their Medicare number information, their name, their address, their date of birth, patient sex, and the beneficiary's signature. Now, this is going to be similar to the beneficiary or the same as the beneficiary information on the claim form. And that's the reason for it. We're using this to adjudicate those claims versus having you fill out, again, say 150 claim forms in order to submit for those services. Simplified billing. This gets attached to that claim form and we process from there. So mass immunization suppliers, they're just a little bit different. So I want to start with a definition of them. A mass immunizer is defined as an entity that is providing the influenza or pneumonia or COVID-19 vaccine to beneficiaries, but they are not otherwise eligible to enroll in Medicare. So if they are, say, a pharmacy that's enrolled as a pharmacy is enrolled for certain injectables. They're not going to be able to use that as a roster biller. They would need to enroll as a mass immunization provider in order to do that roster bill. We typically see this where you have public health clinics as well, public health services. We've seen ambulance services enroll as roster billers because they're doing that and they have qualified staff to issue those, but it's not considered something that they can do as part of their ambulance service enrollment. So it can be organizations or individuals, again, that are not otherwise qualified to enroll in Medicare. They would enroll as a mass immunization provider. And they're typically providing these services outside of a clinic setting. It's typically places such as a retirement community, shopping mall, senior center, grocery stores, health fairs. We've seen it. We have in the area where I live, we have an event center where they actually do a drive-through flu clinic, and people drive through the parking lot and their arm is out the window and they give them their flu shot, and they're doing that as a mass immunization biller. So things work just a little bit different for them. And we'll talk about their enrollment for something like that in a minute. So as I said, some providers are going to enroll as a mass immunization supplier, and it is going to be the only thing that they're doing with that enrollment. And again, it's because they're not otherwise eligible for Medicare enrollment. So there's some requirements for them. They have to be licensed by the state in some way. It just may not be a Medicare eligible specialty, but they're licensed in some way. They are only billing for flu, pneumonia, and COVID-19. That is the only thing that roster biller can do. And so the things that we do see too is they're typically billing during a window, usually the end and the beginning of the year. So they're not billing necessarily every week, every month, because they're, again, only billing for those three. They do still have to have an MPI. Just a reminder that that national provider identifier is required to enroll in Medicare. Having an MPI doesn't necessarily guarantee that someone is a Medicare provider. It's for all healthcare providers and specialties. So even if that mass immunization provider is not eligible for Medicare normally, they certainly can get that MPI so that they can use that for billing other health programs. When a mass immunizer enrolls, they are not required to pay an enrollment fee, as some suppliers are. There's also not a site visit requirement required for them. And a lot of that has to do with the fact that their site visits are not necessarily going to be their site. They're going to have off-site locations, such as I mentioned that event facility where they do that drive-through clinic. That's not going to be a site that we can necessarily do a site visit in. If they're doing a retirement community, if they're doing a shopping center, things of that nature, not necessarily a site that they're going to enroll. We understand and recognize that mass immunization suppliers are not all going to have brick and mortar buildings that they own to provide those clinics. They're trying to get out into the community to expand the utilization of this benefit to beneficiaries. So next we're going to get into the enrollment form, but before we get into that, I do want to check in with Ellen and see if we have any questions in the chat.
Leanne, we don't have any questions at this time.
All right, great. Thank you, Ellen. Okay, so as I stated, if you are needing to enroll as a mass immunization supplier to roster bill, that is all you are going to enroll as. There's a couple of options that you have. Now, typically, people that roster bill can enroll on a CMS 855I, which is for an individual, or a CMS 855B. What we typically see, though, is if someone's enrolling using the CMS 855I, it's an individual who is otherwise licensed to enroll and eligible to enroll in Medicare. So it's a typical enrollment process. If someone is enrolling as mass immunization supplier only, we more oftentimes see they're submitting the CMS 855B, or the supplier enrollment application. So this is going to be for the business itself, the supplier itself, and less about the individuals that are working for that supplier. There are a couple of ways to submit that. There is the electronic version through our provider enrollment chain and ownership system, which you'll hear me refer to as PACOS, or the paper CMS 855B. Both are perfectly acceptable, but there are some differences, and you will, if you've ever attended one of my webinars, you will hear me champion for the use of PACOS, and there's a few reasons for that. One, PACOS works very much like if you've ever done use tax software to do your taxes. It asks you a series of questions to identify you as that mass immunization roster biller, and it only poses you with the sections or topics, as they're called in PACOS, that are required for you to enroll as that provider type. It kind of eliminates some of the other sections that could get confusing. It's not going to ask you about being a hospital. It knows you're not. So it's going to help you along the way. It's also something that can be submitted electronically. You can fill it out and submit it in the same day. And that also means that we process it more quickly. We can leverage some automations. We can leverage just data entry efficiencies, and we see that application much more quickly. So an electronic application, if everything is there and we do not require any development for any additional information, those are typically processed within 15 calendar days, start to finish, submission to receiving your notification letter being sent out. Whereas with a paper application, it is an electronic template, and I've included the link there for you. You can fill it out online. However, you do have to print it off, and you do have to put it in an envelope and send that to us through mail or FedEx or overnight somehow. You can send it regular mail, but then that has to come into our office. It does have to be processed and scanned into our system so it can be ingested into our workload system. And because of that, along with some manual data entry that has to happen with a paper application, a paper CMS 855B or any paper application for that matter that does not require any type of development can take up to 30 calendar days to process. And that's just simply because there's more manual labor involved in doing that. So the other benefit of electronic is that you can see your information. You can see if anything needs to be changed. You can see exactly what we have in the system. So I'm always going to suggest that if you haven't tried submitting through PACOS, that is the avenue that you take. And we do have some videos out on our Encore page, our YouTube page, that actually go through how to do that. So those are the applications you're looking for. Now I'm going to start with the PACOS submission. There's a piece that is just a little bit different, and then we'll start doing a little bit of side by side. But when you are going through and submitting a mass immunization supplier application through PACOS, as I mentioned, it's going to ask you questions. So it starts out with an application questionnaire, and from here it's going to ask you what kind of supplier you are. And mass immunization roster biller only, this is the only thing you're going to do, you're not providing other healthcare services, is a supplier type that you can select. This is really important. This is the piece that allows the system to narrow down the topics it needs to present you with to streamline your enrollment process. This is something you want to make sure that you select here, because if you get much past this questionnaire, you can't change that, and we cannot change that on the Mac side either, and you would potentially have to delete the application and start over. So that is a critical piece of this enrollment in PACOS. Once you have that, PACOS will walk you through the rest. So keep that in mind. From there, we start lining up with the paper application. So I'm going to talk through those. Once you have acknowledged that you're enrolling as a mass immunization supplier, Section 1A is basic information about the supplier, and this is represented on both the electronic and the paper form. It's essentially the application scenario in PACOS, and it's that questionnaire, and it builds that application for you. On the paper application, you will select that you're a new enrollee, and it's going to tell you what sections need to be completed. So on the paper application, which is the image on the right, you're going to see two columns. The first column is tell us what you're trying to do. You're a new mass immunization supplier, so you're going to say you're submitting a new enrollment. We'll get to the specialty on the paper application in a minute. But then the second column, for all of those application types, it's going to tell you which applications. In this case, or sections. In this case, it's going to tell you all applicable sections. So it's just a matter of reading through the sections and determining which sections are going to apply to you in a paper. And one other thing I do want to point out, going back to PACOS, I need to step back just a little bit. it's going to ask you if you're an institutional provider, a clinic group or supplier, durable medical equipment, or a Medicare diabetes prevention program supplier. Even though you're not going to be a group clinic in this scenario, you're going to be a mass immunization supplier, you are going to select that second option because they lump clinics and suppliers together. They have a lot of similar sections. Then we're going to come to section 2A, which is identifying information. So this is going to be information about your business structure. And we're going to want to know what's the legal business name, what's the tax ID. And these sections are similar. They're just located in slightly different sections. Pecos will present it to you. We're going to want to know if there's a DBA. We're going to want to know if there are any other names. We're going to ask questions about whether or not this facility is an Indian Health Service facility. That question is asked because those are all processed by one MAC, and so this just allows the MACs to know where that application needs to go. It will also ask some information about license information for the facility. So if there's a license involved, we need to know that information. Section 2A does continue, and it's asking for a little bit more information. Here, the focus is really going to be is if there are any type of certifications outside of a license. And then it's also going to ask for a correspondence address and a medical records correspondence address. These can be the same. They may also be different. So the difference is a correspondence address is going to be used for a multitude of various communications. And if the enrollment area should need to reach out to the provider directly, we know that everybody tends to have contacts, maybe credentialing or billing services affiliated with them, and that's perfectly fine. We just also ask for a way to contact the provider directly without that. The other reason that correspondence address is so important is a process we refer to as revalidation. So every so often we will invite providers to re-verify all of their information, and that's where those notifications go. So it's really important to have that up to date so that you don't miss those notifications. Medical records correspondence is exactly that. It's an address where if we need to send something out about a medical record, we need to know where we're sending that. And again, the core and the medical records correspondence can be the same, but they could be different. Just depends on your business setup. Next is section 2B and C, and this is where you're going to be selecting the specialty. As you can see on the left, in Pecos, you've already done that. That was part of selecting that provider supplier type, and Pecos has built that application accordingly. On a paper application, this is where you're going to tell the MAC that you are going to be mass immunization. That first section, you were telling us, hey, I'm new, I want to enroll. Here you're telling us that you want to enroll as mass immunization. So you'll check that box, and we will take it from there. Now you're seeing 2C, that's for hospitals only. That is a section that does not apply typically to mass immunization suppliers. And then that is for Part B hospital involvement, not Part A. So that is a section that you will be able to avoid. Next, we have section 3, and this is for adverse legal actions for the supplier itself. This is for whatever legal name you're listing in section 2 at the beginning when we're getting your business information, that 2A. So we need to know if there's any adverse legal actions, and if you answer yes, we do need to have the action defined, the timeline of that action, any resolutions, and we're going to need documentation, and this would need to be court documentation, not a statement from the provider, not a statement from their attorney or lawyer. It does need to be official court documentation. Now, it does need to be answered, yes or no. If it's no, there's nothing further to do. If it's yes, a question that we often get is, okay, does that mean I can't enroll in Medicare? And the answer is not necessarily. What yes means is that you're self-reporting an adverse legal action history, things like felonies, healthcare related crimes, financial crimes, things of that nature, and those are all outlined in the section. But what happens from there is that the MAC reviews this. We may need to communicate with CMS to make a determination of whether the adverse legal action reported is something that precludes the provider from enrolling in Medicare. But I can tell you that checking yes does not mean your application will automatically be denied. There is an independent review of that. Section 4A is the practice location information. Now, this is where it can be a little interesting for a mass immunization roster biller. At the beginning, I mentioned we're, doing that drive-through clinic at an events facility. We're at a grocery store. We're at a retirement community. Perhaps we're going to a church or a synagogue or some other type of religious place. That is totally fine. You're not going to be asked to report those as practice locations. Those are considered off-site. What we're looking for is a location that the mass immunization or roster biller owns. Typically for a mass immunization roster biller, this is what's going to be their base of operations. So is there an office that they dispatch out of? Is there it doesn't even necessarily need to be a place that they're rendering those services, but it needs to basically be their base of operations. Where are they running, organizing their clinics out of? So we'll need that information. And because that is going to be a slightly different type of site, you'll notice that PACOS will ask for this as well, but on the paper application, it gives some pretty prescribed site types. Other is there as well if that needs to be reported. So you have that option and you can explain that it's that admin office or that base of operations. Next, 4B and 4C, this is for special payments address. Now, all providers are paid by Medicare electronically through the electronic funds transfer process, or EFT. However, we do still need a special payments address for a multitude of reasons. Sometimes there are communications that CMS prescribes that we send to that. We're not experiencing this, but if for some reason there were a problem with that, with EFT deposits, we could potentially send payment through that special payments address. Now, I want to be clear, that doesn't mean that the account number, account information has changed and it comes back to us. That's a whole different process. But if there was a problem with transmissions, period, with the bank, something that was outside of an error with the information that we had, that's just an option there. The other thing that you'll see is medical record storage. So we do need to know where those medical records are stored. This is different from the medical record correspondence address. This is where they are either physically or electronically stored. If they're physically stored, we do need to have a street address because we need to know physically where those records are going to be held. So a PO box will not be acceptable here if it's standing on its own. Now, for electronic storage, we need to know if you're storing records electronically, yes or no. If you're saying no, you're done. If you say yes, and if you are, we do need to know where those records are stored. So we're looking for vendor. We don't need a link to the actual system. We don't need to be that detailed. We're looking for the vendor, where that information is, or where are the servers. They might be in your office, but where is that information technically being stored? Next, we have section 4E and 4F. Now, this is specific to mobile units. We do not see these often, but if there was a mobile unit that was doing these mass immunizations and doing it from a vehicle, then we would need that to be provided here. We're looking for base of operations, which may or may not be the same as the practice location that was listed in 4A, and there is an option here for you to tell us that versus duplicating that information, both in PACOS and on paper. But we were looking for that base of operations, and if those vehicles are being used, we do need information on those vehicles. So we need the type of vehicle, and we do need the vehicle identification number, the VIN, and that is absolutely that number that is on the registration for that vehicle. Depending on where you are, it could be a combination of letters and numbers. Could be very long. I know where I'm at, the VIN numbers tend to be very long, and we are looking for that number. Section 4G, again, is for mobile units. This is going to be for geographic location served. So we do need to know City, town, county, state, territory, zip code, it depends. So if you're doing an entire state, we're not going to need the city, county, or zip code, and there's a section there if you're providing services to the entire state. Tell us that, and we're done. If it's only certain cities and towns, we need to know that. If it's only certain counties, we need to know that. State and territory is there. We do sometimes have cities and towns. For instance, St. Louis, it's in multiple states, so you'll identify maybe which side of the boundary that you're on. Or if you're only doing certain neighborhoods, certain zip codes, that is the reason for that. And this can certainly change, and we know that, so it's something that you wouldn't necessarily have to enroll because you've gone to another county, but we would need to know that you're providing services there. Next section is section 5A and 5B, and this is going to be ownership and managing control interest. So this application is going to result in a PTAN, and the provider is going to receive Medicare funds. So with that, to prevent fraud is the best way to prevent fraud is to keep anybody who would do harm to the Medicare Trust Fund out of the program in the first place. So one of the things that CMS requires is disclosure of entities and individuals, which we'll talk about the individuals in a minute, that have oversight or control over the Medicare funds that are being paid to them. Section 5A is for the organizations. So if there are parent companies, if there are government entities that are overseeing the supplier, we're going to need those reported. We're going to need any direct owners if they actually own it. That'd be like a parent company, any indirect owners. So if the parent company is owned by another company, that second company is going to be an indirect owner of the enrollment. Or if any companies have managing control. Sometimes there are business offices that have managing control over the provider and oversight over those funds. The best way to figure out whether or not there's something that needs to be reported and disclosed here is to look at the supplier's organizational diagram and look to see where the lines go. And we want to go all the way up, not just one above the supplier listed in section 2. If there are parent companies, we need to see if anyone has control over them as well. So that's also something that will need to be provided with the application when we have an entity listed in section 5. If there's a government entity, I just want to spend a moment on this. If there's a municipality, a county, or a state government that is overseeing the mass immunization supplier, we will need that entity listed here, but they are also going to need to provide a letter of financial and legal responsibility for the supplier in section 2. And that is outlined in the applications, what information needs to be there, but it is really a signed statement that just states that that government entity will be legally and financially responsible for the mass immunization supplier in the event that any monies are owed to Medicare. They're just going to be responsible. And what that does is it allows us in a government or municipality run scenario, it allows them not to have to list all of the county board members or the city council members. They just have to list what is referred to as their authorized officials. So it just streamlines their enrollment a little bit. Something to be aware if you have one of those entities. So section 6, same information, same reasoning. We are asking though about the individuals this time. So any individual with direct ownership. This includes any of the owners of the entities listed in section 5 if they're there. And again, this is where that legal and financial responsibility comes into play for government entities. We need to know of any indirect owners. We need to know of any managing employees. And this does include board members, directors, and officers. So if an entity is their oversight is through a board of directors, we need those individuals listed. The next section will be section 8, and this is billing agency information. If you are using an outside agency to do the roster billing for this mass immunization supplier. So You may not have one if you're doing it in-house. This doesn't need to be completed. This is an entity other than the entity listed in section 2 that is enrolling. So we need their legal business name. We're going to need their tax ID or social security number if it happens to be a private person who's using their social security number to do this billing. And then we also need a street address because they are going to have billing records and we need to know where those are. Again, here a PO box is not going to be acceptable on its own. It does need to be a street address and it does call that out. Excuse me. Section 12 is a documentation section. From a paper application perspective, this does not need to be completed. It serves more as a checklist. And you'll notice that in PAYGOs, what's going to happen is as you fill things out, as you make selections, PAYGOS is going to create a customized list for your provider type of things you may want to submit or that you're going to need to submit along with this application. So you'll want to run through this. It is based on provider type. For a paper application, copies of those documents would just need to be included with the application. And I want to stress copies. We're not looking for original or notarized copies of anything. We just need copies of them. We have seen where originals of certain documents are sent. With PAYGOS, that can all be uploaded into PAYGOS. It does have to be a PDF or a TIFF format. It will not take images, so no JPEGs or PNG files. And they do have a size limit. It's 5 megabytes. So anything larger than that, you're just going to have to break it up just a little bit. But you can upload all of those documents and they will be attached to the electronic submission. You don't need to fax them in separately or mail them in separately. All comes in a nice package for us. So the kinds of documentation that a mass immunization supplier may need to include, we've talked about some of them. The first one is the tax ID verification, and this has to come from the federal IRS. Examples would include a CP 575 or a 147C. If it's nonprofit, it could be the letter that states that you have tax exempt status or that 501 status. Those are all things that are going to need to have the tax ID and the provider's full legal name listed on it. We are verifying that because that is actually something that the IRS does look at annually to make sure that we have the same legal business names that they do. And if they're different, there can definitely be some challenges that happen if we are not matching the IRS and downstream impact to the provider. So we're trying to avoid that. So we do need to verify that. As I mentioned, organizational diagram for any ownership or managing control that's reported in Section 5. We mentioned that legal and financial responsibility statement as well. Some additional forms that you may need. So mass immunization providers are going to accept assignment. They can, however, still submit a CMS 460 participation agreement if they would like. And then they will need the CMS 588 or electronic funds transfer agreement. And this sets up that electronic payment from Medicare. In PAYGOS, that EFT is actually built in to the system and not a separate form. With a paper, it is a separate form available on the CMS website. In both instances, we do need account verification in the form of either a voided check or a signed bank letter, just indicating the name on the account, all of the account information, and the type of account. And it does need to be a year or less in age just to ensure that it's current. Before I check in with Ellen with questions to wrap up, I just want to show you the resources that we've provided today. We did provide a couple of web articles that we looked at. I also included the reference in the Program Integrity Manual, also referred to as the PIM, Chapter 10. And Chapter 10 is all things provider enrollment, and Section 10.2.4, other Medicare Part B services, includes mass immunization roster biller enrollments so that you have some additional information available to you there if you'd like. with that, I am going to check in with Ellen to see if we have any questions in the chat.
Leanne, we don't have any questions at this time.
All right. Thank you, Ellen. So in a few minutes, you are going to get an email that's going to thank you for attending. Don't delete that without reading that, because this is going to serve as your certificate of achievement if you're attending today's session and would like to use it for credit towards continuing education units. So what you're going to see is an email that looks like the image on the right side of the slide, and it's going to have the date and the contact hours. This email can be submitted to your accreditation or certification body for those continuing education credits. Now, if you did not get that, there's a couple of things that might have happened. One, it might have gone into your junk or your spam filters. Sometimes that happens with these. They're sent out of our webinar software, so that can happen. The other thing is, if you used your phone for audio today, our system doesn't have a way of necessarily recognizing that you attended, so we'll not send out that certificate. However, if you run into that and you need that certificate, that email, and we'll give it again, is at wps.gha.education@wpsic.com. You can send an email to that asking for your certificate. I will need the phone number from which you called in, and once I verify your attendance, I can go ahead and send that out to you. Same thing as if it just didn't trigger. That's pretty rare, but if it didn't happen, just let me know. I will confirm your attendance, and we will be able to get that manually sent out. Follow-up questions. If you think of any questions that you didn't think of today, you certainly have some time to get those to me. We are taking follow-up questions for 7 days, and you can send that to that wpsgha.education mailbox, and just in the subject line, put today's topic. That's going to let the individuals that are monitoring that email know that I need to get this question to Leanne so she can get an answer for that provider. So again, we do have to keep it to the topics of today. If you have something that is claim specific about a claim that's in process or an application that is in process, those still do need to go to customer service because they actually have access to the systems that are adjudicating those claims. They'll be able to answer your questions more fully for you because they'll actually be able to see that. But like I said, any questions on roster billing, mass immunization, send those my way in the next 7 days, and we'll get those taken care of for you. So as I mentioned earlier, we want to hear from you. We want to make sure that you're getting everything that you need out of the webinars and that we're providing you with the best possible customer experience in our sessions. So I would really appreciate it if you could take a couple of minutes to complete a survey for us today. As I said in the beginning, I want to know what you liked, what we could have done better, and certainly this is an opportunity to provide your feedback on topics you'd like to see in the future, either related to mass immunization and roster billing or completely unrelated. Anything Medicare that you'd like to see, throw that in there. We do look at those. Those are very important to us. It drives everything that we do. CMS looks at those because, again, we're trying to provide you with the education that's relevant, that's going to help you navigate that Medicare program. You do have a couple of options of taking that. You are getting the link in the chat that Ellen has placed there for me. And the other option is going to be that you are going to get a pop-up when you leave the session today. That is not spam, that's not malicious. It's just telling you that it is taking you out of our webinar software and taking you into the CMS survey software so that you can provide us with that feedback. So again, looking forward to those comments and appreciate your time providing those. Ellen, one more check. Do we have any questions in the chat?
No, ma'am, we don't.
Okay, thank you. Well, with that, that does end our presentation for today. On behalf of myself, Ellen, and the entire WPS Provider Outreach and Education team, I'd like to thank you very much for taking time out of your busy schedules to attend today. We look forward again to those survey comments, and would like to see what education you'd like to see us offer in the future. Thank you, and you may now disconnect. Have a great day.